Studies to show that when the brain utilizes the ketones, it actually is a cleaner burn. It burns more cleanly. What happens is there's a slow increase in the ketones, which actually starts around 18 hours and gradually goes up, 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 up. So by 24 hours, you have some ketones, maybe 10, 15% of your entire energy source is now going to be ketones. How are you going to feel with ketones? Just fine. No problem. You feel okay, because ketones are giving you all the energy that you need. Then, let's say another 12 hours go by. So you're now at 35 hours, let's say. Now the ketones go even higher and higher and higher. And by 3 days, your ketone levels are really beginning to get even better and even higher.
So if somebody is taking insulin, how does that affect
you? You're doomed.
There we go.
So somebody who's taking insulin, show me somebody who takes insulin every day and, oh yeah, I can lose weight just like that. They can't lose weight. They cannot. I've done it. I've given insulin for 25 years to my patients and I yell at them and nothing happens. So long as their insulin levels are high, they cannot lose weight. And let me tell you something else, the mortality is also higher. Now, I'm talking about type 2 diabetics, okay? Not type 1 diabetics. Now, type 1 diabetics are insulin deficient and they need the insulin replacement. But type 2 diabetics already have a high insulin level and they have insulin resistance. So the insulin levels are already high and now you're giving them more insulin. And that is only going to hurt the patient even more. But your A1C will look better and your glucose will be lower. But show me the data that your survival is going to be better. Show me that you're going to get less Alzheimer's. Show me that you're going to get less inflammation in your body, coronary artery disease, stroke rates. It's all about the insulin, guys. It's all about the insulin. So you got to, chronic state. Now, when you're in the hospital and you're having DKA or some other medical problems and you're having surgery and you're getting on steroids and your sugar levels are high, I'll give you insulin. But that's a temporary thing to bring it down because I want your sugar levels to be ideal while I'm doing surgery on you, because high sugar levels mean poorer recovery. So I want your ideal sugar levels. But that's a different story. I am talking about people who have high insulin levels because they have insulin resistance and you cannot give them more insulin. So you must get your insulin level down. I don't have a drug to give you to bring your insulin level down. But fasting will bring your insulin level down. Because if you don't eat, you're not going to make insulin. Now what's going to happen is that as your insulin level drops, and it's nice and low, your body will become sensitive to the insulin. Just like when any level goes down, you become sensitive. When there's too much of it, your receptors downregulate. So I'm not